Okay, it's live.
Okay, thank you. Welcome everybody to the April Health Committee meeting. We've got a full agenda tonight. We're going to try and keep it to a half hour, but with us tonight, we also have the members of the Social Services Committee. Both the Health Committee and the Social Services Committee are meeting tonight together jointly to discuss how COVID-19, the pandemic, has affected social services and our mental health department, and specifically the services they provide. So I'd like to start off by reading the role of both committees. Can you do that for us, Rebecca?
Sure, Mr. Chairman. Mr. Joyce,
Present.
Reedy, Beston,
Here.
Collins,
Here.
McLean Lane,
Here.
Miller,
Present.
Moriello,
Here.
Ward, and Willingham.
Present.
7 present from the Health Committee. Moving on to Social Services, Mr. Fine,
Here.
Simpson,
Here.
Brewski, Cleary,
Here.
Smith, Lockhart, McLaughlin, Curley, and Chapman. 3 present from the Social Services Committee, Mr. Chairman.
Okay, thank you, Rebecca. So again, we're just going to go through the initial items on the Health Committee to get those out of the way, and then we'll move into the discussion for our mental health and social services departments on COVID-19 response. Okay, so for the Health Committee, under previous business, can I get a motion to approve the previous meeting minutes?
I'll make a motion.
Okay, we have a motion from Mr. Miller. Do we have a second?
Second.
Aye.
Second.
I saw a few. I think I saw Ally McLean Lane for the second. All in favor?
Aye. Aye.
Opposed?
Aye.
Now, I understand we're going to be tabling at the request of sponsor number 2 and number 3. Can I get a motion to table number 2?
They're deemed tabled at the request of sponsor.
Oh, perfect. Okay, number 2 and number 3 are tabled. Okay, under current business, amending resolution number 183 for 2021 regarding the evaluation of the Accord program by the University at Albany. I think I saw Dr. Whalen.
Mr. Chairman, this is through mental health.
Yes, I'm sorry. So Dr. Whalen pop up there. I got a little confused. Go ahead, Dr. Giordano.
Good evening. Thank you very much. Yes, as you said, this is an extension of Resolution 183, which authorized a 1-year research contract that's ending in May of this year with Albany. And we are seeking to enter into a multi-year, no-cost extension through December of 2024 to further evaluate the program effectiveness of the Accord program. As most of you, if not all of you know, is a joint operation between the Mental Health Department and the Sheriff's Department with the county executive and the legislature as well as support. And we're operating in the hill towns with our social work, medic, crisis response team. We anticipate there'll be some expansion in the near future, and SUNY Albany will be there as our research partners.
Thank you, Dr. Giordano. Do we have any questions from the committee?
Just a quick one, Mr. Joyce. Chairman.
Go ahead, Miller.
I hate to ask this in case I missed it, but have we gotten any of those quarterly reports so far in that first year?
Good evening, Ms. Miller. So there is the first 6-month pilot report is now being vetted from all the parties, and it should be released very shortly.
Okay.
We started the program midterm of the year contract. And, there will be a pilot report coming out soon.
Okay, thank you very much.
You're welcome.
You all set, Mr. Miller? Okay, do we have any other questions from the committee? Hearing none, can I get a motion to move?
I'll make a motion.
Motion made by Mr. Besson. Do we have a second?
Second.
Second by Ms. Sally McLean Lane. All in favor?
Aye.
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 Any opposed? Unanimous. Thank you, Dr. Giordano.
Thank you.
Number 5, authorizing an agreement with the New York State Department of Health Research Incorporated regarding the expanded partner services program. I think this one is Dr. Whalen, correct?
Yes, this one's mine. Thank you very much and good evening, everyone. So this is a contract that we've had for a number of years, expanded partner services program. The purpose of this is to improve the provisions of care for those that are living with HIV who have not been receiving regular care, for identifying partners and providing testing and needed health services to them.
Thanks, Dr. Whalen. Do we have any questions from the committee? Hearing none. Do we have any questions from any other members of the legislature? Okay, can we get a motion to move?
Motion.
A motion by Mr. Miller. Do we have a second?
Second.
Second by Mr. Beston. All in favor?
Aye.
Any opposed? Unanimous.
Thank you.
Okay, thank you, Dr. Whalen. Okay, as that wraps up the official business of the Health Committee meeting, I'm not going to call an adjournment. We'd like to at least start the discussion now between our Departments of Social Services and Dr. Giordano with the Department of Mental Health. Sam Fine introduced this proposed committee meeting discussion. As we're all aware, over the past 2 years, homelessness in Albany County is on the rise, and also mental health needs associated with the pandemic. So Sam Fine brought it to brought the suggestion up that maybe get these two committees together and the commissioners just to talk about the needs of our two departments and what the legislature can do to assist these two departments. So what I'd like to do is move right into the discussion. And Sam, would you like to kick it off as Chair of Social Services?
Yes, thank you, Mr. Joyce. I'll just say a few words as well. As you mentioned, we decided that this would be a productive way to talk with these two departments and see ways that we can assist in trying to address these issues here in the legislature. I want to thank both the commissioners of mental health and social services for participating in this discussion, and especially for the hard work that they do in serving the most vulnerable people in our county, and particularly during this difficult and unprecedented time of the COVID-19 pandemic. As legislators, I think, we want to learn about the challenges our county departments are facing, how they're adapting to these challenging times, and what type of assistance and help that we can provide in meeting any challenges they're facing. And, as we know, homelessness, it's a problem that affects many people in our county. The causes are complex, and, there's part of it's increasingly unaffordable costs of housing, difficulties in finding stable housing, mental health issues, and much more. And, in Albany County, I know we pride ourselves in that we care about our residents. We're fortunate to have strong social services network, both services provided by government and the nonprofit sector. And we're also always looking for new ways to better serve people and to address the problems we face. And many of these problems, they're not problems isolated to Albany County, but we are often, we try to be leaders on addressing these issues in Albany County. So my hope today is that we can make some progress in finding some solutions to better serve our residents. Thank you again, everyone, for joining.
Thanks, Sam. Maybe what we'll do is move right into the commissioners at this time. If we'd like to start off with maybe social services, I know we provided some thoughts and some questions ahead of time. Discussion around these concerns, or if there's anything the legislature can do to better assist your department through the pandemic, the response to it. So would you like to start us off?
Oh, okay. So, good evening. I'm Michelle McClave, Commissioner at Social Services. Do you want me to just answer the questions, or just open it up for questions to the committee?
You could answer, give an overview, answering some of the questions that Legislator Joyce and I sent you in advance, and then we can open it up and have a discussion.
Okay, great. So one of the questions was about the city mission, and I just want to as I said in my answers, I want to be clear that they accept no government funding and they're not overseen by DSS. They're not overseen by any other government entity. They are a private nonprofit and they have their own mission and services, and happen to serve a lot of people who aren't necessarily Albany County or of origin of Albany County. So DSS utilizes the city mission as needed, and that is for people who can't use our services for one reason or another, or don't want DSS services. There are a number of homeless people that just don't want us in their business at all. And so we will make referrals to city mission for those folks. And in code blue, if we're full, we've got to use the city mission because we've got to put everybody in a bed during a code blue night. And regarding case managers, each of our contracts, which each of our contracted shelters, which is not all the shelters in the county, we have 5 contracted shelters. They are required to have case managers on staff, and it is their staff that we subcontract with the shelters, and they hire their own case management staff. But we kind of we direct them and oversee what the services that they're required to provide to the homeless folks in their shelters. So each shelter, depending on the size, will have 1 or 2 case managers. We also at DSS have a homeless team. So we have a whole team, takes up, the homeless are really kind of a small portion of the people that we serve at DSS regarding numbers, but they take up a disproportionate share of services and staff time than other people who receive other kinds of benefits at DSS. So we have a whole homeless team, and it includes case managers here, client support specialist, and eligibility staff, because we want to make sure we're working with people to get them enrolled in benefits, get them going to programs, help them find permanent housing. We want to make sure the shelters are doing what they're supposed to do according to their contracts, and get people more stabilized and find out what the reason is why they're homeless and try to address that. So that's kind of what our background is. Plus, there's a lot of work that's done with other community providers. There's a lot of providers in the community offering some type of homeless related services. There are shelters that are private, other shelters that are private. One is called Family Promise, I think it is. All right. There's shelters that serve youth and under the age of 18. There's Community Maternity Services has shelters for pregnant or parenting teens. So there's other shelters out there that we don't have purview over or work with. Well, we work with, but we don't, have any oversight. And we work with Hattis. Hattis is our on-call service. We contract with them to provide on-call services during nights and weekends. We provide homeless service during the day, Monday through Friday. We work with the Albany County Coalition on Homelessness. That they coordinate all the different homeless services in the county. There's also services for veterans that we don't oversee, but are provided by the Albany Housing Coalition. So there's a lot of interface with a lot of community providers that we also do work with. And there's something called the Coordinated Entry Program, which is a group of community providers who get together and look at the list of people in homeless shelters. They assess each person and determine what kind of housing would be good for them and what the right match might be. And they try to find that housing for those individuals. The unfortunate part right now is there's 220 people on that list, and that's pretty high compared to other times. So it just keeps growing, that list of people who are seeking housing and want housing. So that group together makes decisions on, for instance, if there's supportive housing program, a supportive housing slot that comes open, they talk together and say, okay, this person is going to be a good match for that program. So they make the referral. So there's a lot of that kind of work that also happens kind of more globally. And has the number of homeless individuals increased? I think it's really hard to say. I don't think it has. The total number hasn't increased, although it may appear that it has, because folks seem to be more visible on the streets. But as far as there is something that CARES does once a year, they're required by HUD to take account of homeless people in the county one night every year. And that's called the point in time count. So that occurs usually in January. It occurred in February this year. And I gave you the list of the total homeless that were identified. Every program and every provider does a count, and people are assigned to different parts of the county to actually go out into on the streets and do this count and find people who are unsheltered. So in shelter, it's fluctuated, but in the last, in 2020, it was 622 people in our shelters that night. This year was 536 in our shelters. The homeless on the street went up a little bit this year. So from 2020, it was 54 people on the street, meaning they don't want to, they're not in a shelter. They don't want to go to a shelter. They're on the street, and it's 67 in 2022. So the total number of homeless, though, is really like in the year 2018, it was 692. This year, the count was 603. So it's somewhere around 600. It seems like it's staying there. And I think we've got a pretty good count of the unsheltered homeless, the folks that are on the street, because we have a really good working relationship with Joseph's House, who runs what was formerly the homeless outreach van, the hack van, and they are in every territory of the county, and they know a lot of the homeless folks and they have relationships with them, and I think that's a pretty accurate count for this year. I think there's a question.
Is there, excuse me, is there a question from the committee? Either committee?
Yes, I have a question. Just listening to what you were saying there are about 600 homeless people that we know of in the county. And of those 600, there's maybe about 50 of them, 60 of them that don't want any help, and they don't want to go to shelters. I know there are a lot of services out there, a lot of programs to help the homeless. What is preventing the other 540 people from seeking those services and getting them their lives together and seeking the help they need to not become homeless any longer?
Well, we are providing the services to the majority of them. If they're in one of our shelters, they're getting a focus. Someone is talking to them, someone's interviewing them, someone's looking at what their needs are, someone's looking at what their financial situation is and how they became homeless, why are they still homeless, etc. So those people we are working with, and it's not always easy.
What's your success rate then, I would say, in helping these people turn their lives around? If I think you said 1 year there were 692, then that following year there was a little over 6. So I mean that's good. You've almost eliminated 100 people that were homeless. So do you measure your success with these programs?
Yeah, and I think I handed out. There's certain criteria that we are required to collect by OTDA, and it's really about permanent housing. That's our goal, is to get people into permanent housing from shelter. So we're working with the individuals and families in shelter, and our goal ultimately is just to get them in permanent housing. So it's just to give you an example, in like the last year from 10/20 to 9/30/21, Singles and families are very different. And we could talk for a day about the difference between singles and families, but permanent housing placement, only 7% of singles got it, 40% of families. So singles tend to be a little bit more resistant and have more problems. They might be active substance users and be very resistant to getting into treatment. And not be successful in a permanent housing. So it's kind of a cycle for some of those folks. And so we end up doing pretty well with families. Over 80% of our families end up getting into some kind of more permanent housing. Some people we need transitional housing, which is like the Marillac shelters, more of a transitional housing for families. And that provides intensive case management, really intensive connection to the services that exist in the community, helping people with the schools, interfacing with if they're in substance abuse treatment, making sure they get to their appointments, and it's just really intensive support that is needed to get these families so that once they do get into housing, they're going to be able to function and stay, because you don't want them to be kicked out again, right? So
you measure your success by the number of people that actually find permanent housing. I think that's a good way to measure your success. But then you also need other agencies and other people to help you, because you have people out there with substance abuse problems, mental health problems. And if these people are afraid to get treatment because they don't want to get off drugs, I know that makes it more difficult. How would you handle those individuals that have a substance abuse problem and really don't seek the help, but we need to get them off the street?
Mr. Moriello, can I just interject here real quick? Only because a few folks might have to jump off for public safety. And we have, I think Dr. Giordano can probably chime in on that. Commissioner McClave, can we just have Commissioner Giordano speak too, and then we can ask questions of both of you as we, with our remaining time?
Yeah.
Okay. Dr. Giordano, I think some of the questions Mr. Moriello is asking tie into Department of Mental Health. We know you've had a tremendous workload these past 2 years, and numbers, your workload is just increasing, and I'm sure we can expect it to increase even more as we come out of the pandemic. But would you like to speak briefly on this before we run out of time?
I would very much like to, and I appreciate yours and the committees, both committees' interest. We're experiencing a confluence of factors that are affecting both Commissioner McClave's world and mine. And I'd be glad to answer any questions at this or any future point. But I want to highlight a couple of things and then maybe ease into answering some of the questions that were just posed. From the standpoint of the mental health department, I think it's important to understand that not all unhoused people have mental illness or addiction problems. The national numbers are anywhere from 15 to 25% might have mental illness, and up to 50% if you add into that the substance abuse issues that Mr. Moriello was talking about. But it's still a subset of the larger group. That's one point I just would like to set the stage with. The other is that, again, appreciating all of your attention, the light that's being shined on the mental health and behavioral health world. We've been under strain for many years, and COVID was not helpful, but it didn't cause the problems that we're experiencing. I did send forward some written material. If you haven't seen it yet, hopefully you will at some point soon. But we've experienced a couple of challenges that are some are chronic, some are more recent. The downsizing of the state psychiatric systems from 96,000 patients in the state system in 1955 to 3,000 in 2022. It begs the question, where did those people go? And they've come back into our communities. And you've probably heard me say this many times, but the money on the federal level or on the state level has not followed those patients. So we struggle before COVID to try to create safe and affordable opportunities, both in treatment and housing for these people. But that's a challenge that we deal with every day. We also house, for better or worse in Albany County, some regional programs in both the addiction field and the mental health field, not least of which is the State Psychiatric Center at CDPC. And that adds some challenges that are very unique to us. The folks who come here for addiction treatment, part of their recovery that's recommended as their discharge from treatment is don't go home. Home is where the problem was. Home was where the drugs were. The state psychiatric system, the state psychiatric hospital has a 9-county catchment area, but they discharge people into our programs in Albany County. That increases the demand every day. And COVID didn't help, not only that it caused more suffering, but it also closed many of the day treatment programs that were through our system, leaving people with nowhere to go during the day, and their visibility on the street, as someone said, is greater whether they're housed or not. So that's kind of the stage that we are working with. But almost every program that we either deliver directly or contract with tries to address the issue of homelessness. This department, the Albany County Department of Mental Health, operates what we call a single point of access, known as a SPOA. We oversee, right now, it's in excess of 840 individuals who are at different levels of housing in the community who otherwise would be homeless, who have been discharged from hospitals, who are finally getting their lives together through their involvement with treatment. Our role as a county is to prioritize whatever vacancies come up in group homes, in supported apartments, in independent living situations, to make sure that those folks most at risk are getting the services they need. 840 is a big number, but we're always just touching the tip of the iceberg. So all of our direct programs, our mobile crisis team, our assertive community treatment team, even our jail mental health program, all have housing specialists attached, so that part of their discharge work and work in the community is to always be attentive to this challenge of homelessness. So that's kind of the frame around this. I'd be glad to, I did send along a bunch of things around some data from recent years. Commissioner McClave and I have a little bit different numbers on that point in time study, which I think she and I, we should look at together afterwards. But we look at, just to give you two other points of data to give you a sense of the scope of what we do. We provide a host of services, and we contract with almost 60 agencies in town. At any given point this month, there are about 2,400 people receiving addiction care in Albany County. Any of those people are at risk for further deterioration in their condition and becoming homeless. There are almost 3,000 individuals receiving outpatient mental health treatment at any given point in Albany County. This doesn't even talk about the hospitals or any of our case management programs. There's an enormous number of folks who are getting quality interventions that are keeping their lives on track. But any of those folks are at risk for some of the things that we're talking about right now. And I think that even though the mentally ill are a subset of the homeless, unfortunately, they make more known of themselves to businesses and to police and to other folks because they call attention to themselves, unfortunately, through their behavior on the street. But two last things, our suicide rate in Albany County, the average before the pandemic, way too high, but it was 40 a year. In 2020 and 2021, it actually went down. It averaged 34 a year. And you probably know our opiate overdose numbers, which were averaging in the 40s before the pandemic, are now averaging above 100. So, we're not perfect and we have a lot of work to do, but we're working with a lot of folks who are trying to keep them in supportive housing.
Thank
This is Carol.
Dr. Giordano, Commissioner McClave. I know Commissioner McClave had submitted some answers to the two committees, and we can share that with the legislature. And Dr. Giordano, I haven't seen yours yet, but I'll review it and also share it with the two committees.
Please do. Thank you.
As the eviction moratoriums get lifted, I can only imagine it's going to impact social services and also Department of Mental Health. Commissioner McClave and Dr. Giordano, could you just speak briefly on your forecast for that, or what we can expect? Maybe start with Commissioner McClave.
Can I ask a question? Because I know people are going to leave, and this is Carolyn. And I've heard a lot of numbers. And I'm sorry, Mr. Chairman, but I need to ask. I'm asking you if I can ask the question first.
Okay, go ahead, Carolyn.
I heard a lot of numbers. So I was just wondering, for the homeless as well as those who are receiving mental health services, do you have them tracked regionally? I know we're talking Albany County, but do you have them separated out by what towns they're in, and even in, like, for Albany, what parts of the city they're in? Do you keep track that way?
Yes, Carolyn, it's Dr. Giordano. If I could just jump in and say that we track by zip code, and we've submitted to a number of legislative requests over the last year to give those updated reports, and we're always glad to do that. But yes,
okay.
In terms of the programs that we directly serve, we have that data and we can run those reports at any time. There's a lot of programs that we contract with, and I can't speak for those, but of the many hundreds, if not thousands of people that the county serves, we have zip code level data on.
Well, yeah, I would like access to that. And Mr. Chairman, thank you very much for allowing me to interject.
Sure. Ms. McLaughlin, we're running short on time, so I don't want to deny anybody a chance to ask a question if they could kind of keep it brief, and while we have Commissioner McClave and Dr. Giordano with us. Are there any other questions from either committee? Mr. Fine, do you have any questions for either commissioner?
Yes, first of all, thank you, Commissioner Giordano, Commissioner McClave, for joining this conversation. It seems like we, one thing that we have to do a better job at is individuals, is getting, individuals into permanent housing. And, Commissioner, I know you explained some of the difficulties in doing so. It sounds like we do a much better job of helping families get into permanent housing. You mentioned you mentioned today and in the notes you sent, which we'll send out to people, that there's a very long wait list for the coordinated entry program. And it seems like that's one of the big barriers. You mentioned the coordinated entry list is long due to a lack of sufficient supportive and other specialty housing programs geared toward the difficult to place and competition for low-income rentals. So, it seems like we have a lack of supportive housing and also just a lack of affordable housing units in general. And just wanted to hear your thoughts on what can we do as a county to help address these issues?
It's really hard to say, because a lot of the housing that we need for the folks that we're serving, which are really intensive, some of them, it needs to be developed. So it needs to be coming from the state. There are state programs that create new supportive housing. You've got to find ways to build them, to renovate them, and then, but the biggest problem really is ongoing support, and that really needs to come from the state, because you're going to have people in these apartments for years and years and years, maybe for the rest of their life, and you've got to have the oversight and the case management and the intensive services that some folks are going to need. They're just not going to transition out of supportive housing
So is there state funding available that can we, look for state funding, work with nonprofits, organizations that may run these, supportive housing, and work with them to get more housing built in Albany County?
It's happening every year. Every year the state puts out an RFP, and every year we have providers applying, and 50 here, 20 here. So, I mean, they're building capacity. I don't know how, what I don't know how to do is stop the inflow of new people. We're always getting new homeless people coming to our door. And as I said, we have better luck on housing families because sometimes they tend to be higher functioning and not as likely to be substance users or have mental health issues. So we are able to, it's financial and poverty, the reason why they truly are homeless. So, but we keep having new people coming in. So that's the problem, preventing eviction, but some of the people that get evicted are because of code violations. So the facility, the housing is so poor that the code shuts it down. So they become homeless that way, or because of fire or other kinds of things like that naturally happens. And so I'm not sure. A really better, more expanded low-income housing stock with supportive housing, but that's Albany Housing Authority housing. That's, program housing that other nonprofits are running.
Yes. Yeah. And if we can find a way if we can build more affordable housing units in general, that might lead to less people losing their homes, becoming homeless. Also, if we're, able to house people quicker, of course, people are always going to come into the system. We want to minimize that. But if we can house people and get them, permanent housing and help them at a faster rate than they're coming in, then we'll be reducing our population of homeless people.
Would it be possible to think about the land that we have tied up in the county land bank as some potential to use for this affordable housing?
This is Mike from the county exec's office. So the land bank is actively involved in this process as well. They have ongoing projects where they land bank empty property. So the most difficult properties they have to get rid of are empty lots. So they actively land bank properties and then gather enough together to make it appealing to develop. And whenever there is a development, there is always affordable housing involved. Typically, it's a mix to make the development viable. So they have at least one, if not two, of those exact developments going on right now. But it's all a matter of, it takes time because you need to get enough together to kind of initiate the project. Without that economic of scale, you need enough units. Unfortunately, they do large numbers of units typically, but that's how that process works. But they're actively involved.
Thank you.
Thanks, Mike. So we are cutting into the Public Safety Committee meeting at this time. Maybe what we can do is get the responses from Commissioner McClave and Dr. Giordano out to the legislature. And if anybody has any additional questions, we can forward them along. I think this is going to be it's going to be a process for these departments and for our county. So that said, Sam, do you have any final comments, questions before we can adjourn the meeting?
I know that's it. Just want to thank everyone for participating and looking, forward to, getting all those answers, and we'll share them with people. And, hopefully this will lead to some further discussions about how we can better address these issues.
Thank you, Mr. Fine. And thank you, Commissioner McClave and Dr. Giordano for joining us tonight. Appreciate your time and everything you're doing for Albany County. So thank you.
Thank you.
Thank you very much. Good night.
Get a motion to adjourn.
Motion.
Motion made by Mr. Miller. Second,
Second.
second by Ellie